want to learn how to pass pharmacology on your first attempt, stick around here. My name is Tribe Nursing. I make all types of nursing content related to patho, pharm, and I even do nursing skill videos as well. And I even provide study tips. If you are new here, make sure to hit the like button and subscribe, and make sure to share with your friends. And with all that being said, let's get started. Pharmacology is one of those classes that can be very difficult for students to pass. Not because of the level of difficulty of the class, it's more because of time management. Time management is an essential skill to have throughout your nursing school courses. Time management is the first rule of passing pharmacology. It's important to avoid last-minute studying. Last-minute studying could be very detrimental to your overall grade in pharmacology. It's important to have a planner. Having a planner is essential because it allows you to have a to-do list to make sure you have completed all your tasks throughout that day. Although, if you do have downtime, for example, if you are running an errand like going grocery shopping or getting an oil change, make sure to bring a set of note cards with you to use while you are sitting down, because using note cards is a great way and a great method to passing pharmacology. And as a matter of fact, that is our second rule on how to pass pharmacology. In my opinion, I believe note cards is the greatest method for passing pharmacology because it uses two types of learning methods. It uses passive learning and active learning. So what is passive learning? Passive learning is where you are internalizing the information that you are receiving through someone teaching you. For example, your professor lecturing you, you are absorbing that material, understanding it through his or her point of view on how to understand the material. So you are internalizing it and just soaking it all in. Active learning is another way and one of my favorite ways of understanding a certain concept. Active learning is all about engaging students to using note card methods, using the whiteboard to understand and grasp a subject area. It's a great way, in my opinion, to actually understand a concept. But it's important to use passive learning first and then active learning. The note card method is considered to be an active learning experience that helped me throughout nursing school. I have personally written 13,000 plus note cards to this day throughout nursing school, and I used note cards all throughout my nursing courses. No matter what course it was, I made sure to use note cards to understand the material. Using the tribe nursing method is a third rule. This kind of goes back to the note card method. I'm going to set up a way to understand pharmacology medications so you can use passive and active learning at the same exact time to pass your next test. Also, it's important to mention that I'll be creating a follow along series on this channel where you can use the note cards I have written with pharmacology medications so you can follow along with the videos and write out everything that I am teaching to you. For example, I'm going to list out a medication and I'm going to explain all the uses for that medication. So I'm going to go ahead and show you how to properly write out a medication so you can use passive and active learning methods. So let's say you have your note card out. The way I like to write my note cards is in a horizontal point of view. So imagine this is your note card and it is in a horizontal shape. So how I like to set up my medications, at the top I like to put the name of the medication, the use of the medication, the side effects, and adverse effects. And at the bottom, I like to put the nursing interventions. You could put it in any order, but this is the order I like to put it in because it just makes more sense to me. So, for example, the name of the medication that we will be using for this demonstration is captopril. That is the generic name of the medication. I also like to add the brand name. For example, captopril, the brand name is Capo 10. On nursing exams, your professor might not use brand names. It's important to clarify that information, but typically they will be using the generic names. So captopril, you can actually use a lot of the pril medications, PRIL medications, and use that as a overall no card. So lisinopril can be used as the same information, and it's actually going to be the same general information as far as what the name of the medications are. So using the last few letters of the medication can generalize all of the information that you need for that class of medication. So for example, the name of this medication is captopril, that's a generic name. The brand name is Capitan. The use of this medication is used for hypertension, heart failure, and myocardial infarctions. Side effects and adverse effects of this medication is angioedema, cough, and an elevated potassium. Something that I would love to point out for captopril, for example, is that since captopril is a class of medication known as ACE inhibitors, something that I came up, which is a great method to understanding ACE inhibitors, especially for the side effects and adverse effects. Check this out, ACE, and this spells ACE. ACE inhibitors. Using ACE inhibitors as a classification and understanding that these are the side effects / adverse effects gives you a great understanding of what these medications can possibly do to a patient. The nursing interventions that are important to mention with these medications is that you need to monitor this patient's blood pressure. Monitoring this patient's blood pressure can be extremely crucial, especially if their systolic function and diastolic function are very sensitive to hypertensive medications. Changing the position slowly is also an important method for nurses to understand. For example, if your patient is laying down after administering an ACE inhibitor medication, such as captopril, and they use a call light, they need to get up to the bathroom, it's important to have the patient sit up at the edge of the bed and have them dangle their legs for 30 seconds to a minute, their blood pressure to stabilize before getting them up. Because an issue with this is that if a patient gets up too fast, they can drop and faint and possibly hit their head, and that is a very big issue within the hospital setting. And another nursing intervention to also understand is to avoid foods that are high in potassium, because this medication can elevate the patient's potassium levels. So using these methods can really advance your pharmacology grade, and it can really allow you to understand the material from a passive learning point of view and an active learning point of view. Using those two methods are extremely crucial in understanding pharmacology. And I even used it throughout my nursing school courses, not just pharmacology. So I hope you enjoyed this video. This video will soon become a video series where you can follow along with these nursing medication videos, and you can write out everything that I explained to you, just how you've seen it on your note cards. And if you like these types of videos, make sure to hit that like button down below and subscribe if you have not.